A taxonomy is a mechanism used to categorize things according to their relationships to one another. The cognitive domain. The cognitive domain is known as the thinking domain. Learning in this domain involves the acquisition of information and refers to the learner's intellectual abilities, mental capacities, and thinking processes. Objectives in this domain are divided into 6 levels, each specifying cognitive processes ranging from the simple knowledge to the more complex evaluation. Levels of cognitive behavior. Knowledge. The ability of the learner to memorize, recall, define, recognize, or identify specific information, such as facts, rules, principles, conditions, and terms, presented during instruction. Comprehension. The ability of the learner to demonstrate an understanding or appreciation of what is being communicated by translating it into a different form or recognizing it in a translated form, such as grasping an idea by defining it or summarizing it in his or her own words. Knowledge is a prerequisite behavior. Application. Ability of the learner to use ideas, principles, abstractions, or theories in particular and concrete situations, such as figuring, writing, reading, or handling equipment. Knowledge and comprehension are prerequisite behaviors. Analysis. The ability of the learner to recognize and structure information by breaking it down into its constituent parts and specifying the relationship between parts. Knowledge, comprehension, and application are prerequisite behaviors. Synthesis. The ability of the learner to put together parts and elements into a unified whole by creating a unique product that is written, oral, pictorial, and so on. Knowledge, comprehension, application, and analysis are prerequisite behaviors. Evaluation. The ability of the learner to judge the value of something, such as an essay, design, or action, by applying appropriate standards or criteria. Knowledge, comprehension, application, analysis, and synthesis are prerequisite behaviors. Examples of behavioral objectives in the cognitive domain. Analysis level. After reading the handouts provided by the educator, the family member will calculate the correct number of total grams of protein included on average per day in the family diet. Synthesis level. Given a sample list of foods, the patient will devise a menu to include foods from the 4 food groups: dairy, meat, vegetables, and fruits, and grains, in the recommended amounts for daily intake. The affective domain. The affective domain is known as the feeling domain. Learning in this domain involves an increasing internalization or commitment to feelings expressed as emotions, interests, attitudes, values, and appreciations. Levels of affective behavior. Receiving. The ability of the learner to show awareness of an idea or fact or a consciousness of a situation or event in the environment. This level represents a willingness to selectively attend to or focus on data or to receive a stimulus. Responding. The ability of the learner to respond to an experience, at first obediently and later willingly and with satisfaction. This level indicates a movement beyond denial and toward voluntary acceptance, which can lead to feelings of pleasure or enjoyment as a result of some new experience. Receiving is a prerequisite behavior. Valuing. The ability of the learner to regard or accept the worth of a theory, idea, or event, demonstrating sufficient commitment or preference to be identified with some experience seen as having value. At this level, there is a definite willingness and desire to act to further that value. Receiving and responding are prerequisite behaviors. Organization. The ability of the learner to organize, classify, and prioritize values by integrating a new value into a general set of values, to determine interrelationships of values, and to harmoniously establish some values as dominant and pervasive. Receiving, responding, and valuing are prerequisite behaviors. Characterization. The ability of the learner to integrate values into a total philosophy or worldview, showing firm commitment and consistency of responses to the values by generalizing certain experiences into a value system or attitude cluster. Receiving, responding, valuing, and organization are prerequisite behaviors. Examples of behavioral objectives in the affective domain. Receiving level. During a group discussion, the patient will admit to any fears he may have about needing to undergo a repeat angioplasty. Responding level. At the end of one-to-one instruction, the child will verbalize feelings of confidence in managing her asthma using the peak flow tracking chart. Characterization level. Following a series of in-service education sessions, the staff will display consistent interest in maintaining strict hand-washing techniques to control the spread of nosocomial infections to patients in the hospital. The psychomotor domain. The psychomotor domain is known as the skills domain. Learning in this domain involves acquiring fine and gross motor abilities with increasing complexity of neuromuscular coordination to carry out physical movements such as walking, handwriting, manipulation of equipment, or carrying out a procedure. Levels of psychomotor behavior. Perception. The ability of the client to show sensory awareness of objects or cues associated with some task to be performed. Cues relevant to a situation are attended to, symbolically translated, and selected to guide action, gain insight, and receive feedback.